Let's see. Before I get started, anyone need any medication? After mine, you probably will. Every system's perfectly designed to get the results that it gets, and our healthcare system has been designed to do that. When you hear David and when you hear my presentation, it's going to sound like we've been doing something wrong, and we haven't. We've been doing exactly what we've been incentivized to do. So I don't want us to feel bad. Anybody who has done what they have done has acted totally rationally. The problem is that the results we're getting has put tremendous stress on our healthcare system and our country. This is a crucial conversation, and because it's really, I have two primary reasons why it's so crucial. Number one, I just turned 60, so I'm more likely to be a patient than not in the near future. And number two, I have a grandson. And I did a calculation. He's 18 months old right now. When he's 28 years old, if he has a family of 4, if the current trends continue, the total cost of providing his family health care will be $58,000. It's unsustainable. Something has got to change, and so we need to talk about this. What do we learn from experience? This is a great quote. What we learn from experience is we never learn anything from experience. And the reason I bring that up, and that's particularly true with patients. You know, by the way, there's a term, and I have one minor issue with David, and that is, yes, we should be responsible for dealing with nutrition, because nutrition relates directly to health, but it's really tough when we're fighting McDonald's and folks like that. Google the term craveability. It's actually a term that's used by the food industry to try to get us addicted to high sugar, high fat, high salt foods. The highest craveability, I think, are Dunkin' Donuts, by the way. They just won. But if you don't change your lifestyle, there'll be consequences. I'm sure you physicians have told this to your patients on numerous occasions. And the response back was, what are you talking about with all this doom and gloom? Right now, I feel great. Well, it's the same issues with healthcare, and it's the same issues in business. One of my favorite financial advisors is this guy, Gary Schilling, who in 2002 said the housing boom is soon to go bust and it will affect everyone. 2002, it went bust in 2007, 2008. But the math didn't work. We were selling people mortgages that they couldn't afford to pay us back, and he knew sooner or later it would go bust. And what was the conventional wisdom when Gary said that? All that doom and gloom forecast is not only irresponsible, it's downright wrong. And when you look at the established players in this industry, this is a kind of an interesting quote from 2007. We produced another year of record performance, successfully managed through a difficult market. We're proud of how far we've come and excited about our opportunities ahead. Richard Fuld was the CEO of Lehman Brothers. So the problem we have is when there's structural change, those prophets of structural change are usually painted as people with doom and gloom. Why should we change? We feel great. And the problem is that every business is susceptible to these inflections. And inflections are defined as things that cause a fundamental shift in your business strategy. And there's usually 4 things that cause that. One is new technology. Been to a Blockbuster lately, or Barnes & Noble? You saw what happened with what's the TV store that just showed really bad results? Best Buy, yeah. You know what they call Best Buy now? Amazon showroom. Yeah. Regulatory change. Remember the Bell system? I grew up in the Bell system. By the way, if you haven't noticed, we have a few minor changes in regulation. Affordability. And then finally, customer convenience. And all those factors are changing in our industry, and it's going to have a huge effect on us. So the question I'm asked by folks all the time is, when's the right time to change? When should we change from volume to value? And if you look at all the other industries that have gone through structural change, what you find out is, and how do you do it without disruption, industry transformation is neither predictable nor linear. David said it's going to change in the next 2 to 3 years. I don't have a clue. I honestly don't. I don't know if it's going to be 3 years or 7 years. I know we're going to try to change it. Things tend to take longer than you first think about in healthcare. The second thing is that established organizations have difficulty overcoming resistance and try to wait for the perfect time to change, and it's usually too late. And the classic example I use, of course, is Kodak. So I want you to picture for a second, we're all consultants, and we're working for Kodak. Now, for those of you who don't know, 1975, this is an engineer named Steve Sasson. He invented the digital camera, 1975. At that time, he worked for Kodak. Kodak invented the digital camera. But how'd they make all their money? Film, right? So what happened is, so we're consultants and we're trying to give Kodak advice. And there's a bunch of 50 to 60-year-old senior executives and senior engineers in Kodak. And let's pick a period of time. Let's pick 2000. And we say to them, turn your company on your head. Instead of selling film, you need to start selling digital and put yourself out of business. Well, let's take a look at the trend line. We're saying that in 2000, 2005, they had their third best year ever selling film. It's not linear, it's not predictable. And then what happened? Well, the rest is basically history. So what was the inflection point that basically put Kodak out of business? Does anybody know? What was it? What was the one thing that happened? Yeah, we no longer had to carry pictures in our pockets, right? So here you are, 2000, and you get in front of a group of people like this, 50 to 60-year-old senior executives from Kodak, and you say, here's what's going to happen. By 2007, some stoner in California is going to invent a phone and put your company out of business. That's kind of what David just told you, wasn't it? So what do? By the way, we do have a lot of new technology coming up down the pike, and I'm really thrilled this is your future patient. This, by the way, is the Watson, the Computer One Jeopardy, that's now providing decision support at MD Anderson and at Memorial Sloan Kettering. If I have cancer, I would, while I respect my oncologist's opinion, I would like to have all the information known to mankind at his fingertips. This, by the way, is 2Net. It was designed by a small company called Qualcomm for home monitoring. By the way, if you don't feel well right now, not a big deal. Just pick up your iPhone, 40 bucks, and you can talk to a doctor on demand right now. And by the way, the entire laboratory business is over. There's this new company here called Theranos. I think Henry Kissinger's on the board. And instead of vials and vials of blood, this is literally all they're going to need to put on a digital chip. And they've guaranteed Medicare that when they go fully commercial, that they will charge half of what Medicare's rate schedule is for all of the laboratory services. So it's just a matter of time before that changes. So we need to have a crucial conversation. And crucial conversations, it's actually a concept. I've read the book. If you have a spouse or if you have children, you should learn crucial conversations. But the reason I was so fascinated with it was because of a lady physician I had lunch with about a year ago from Canada, who now runs one of their largest medical centers. She said the first thing that I did when I took over was everybody got trained in crucial conversations, because we're afraid to talk to each other about highly emotional issues, and we stay silent. And what's scary about that for me as a future patient is there was a study done called Silence Kills. Turns out that 53% of nurses and 68% of physicians who were surveyed said they were concerned about a peer who was incompetent. That means that they did something dangerous at least once a month. The problem's gone on for more than a year, and at least one patient was hurt. And then they asked these people, well, how many of you either confronted that peer or turned that person in? And you can see the results. Here was a quote from one of the physicians. There's a cardiologist who everybody feels is incompetent. He makes himself very accessible to the GPs, so he gets a lot of referrals, but the physicians who have to work with him would never put someone under his care. And what would the hospital call this cardiologist? A medical staff leader, a hero, a high admitter. So we need these crucial conversations because physicians always get, and hospital administrators, when I give this presentation, always get depressed because the good old days are over. Well, by the way, they weren't that good. We had, in the richest country of the world, we had 40 million people uninsured. 22% of the people delayed medical treatment who were insured because they couldn't afford it. 54% of all personal bankruptcies are a result of unpaid medical bills. Dr. Wachner, who is the inventor of the term hospitalist in this country, says 40 to 80,000 deaths occur a year due to incorrect or delayed diagnosis. 440 Americans per year experience preventable adverse effect. Tens of thousands of patients are getting unnecessary tests and procedures. And physicians are being forced to practice defensive medicine to avoid frivolous lawsuits. And if you think that's the good old days, for us patients, it sure wasn't. So unfortunately, we didn't solve this problem ourselves, and so the government stepped in and created this highly flawed but essential law called the Affordable Care Act, which is an attempt by bureaucrats to expand coverage, make health care more affordable, implement a more rational payment system tied to value. The problem is it neither reforms health care nor makes it affordable. It's a mess. That's not a political statement, it's a mess. I'm not worried about you getting ready for health care reform law. I'm worried about you getting ready for what happens when the law does not work and reduce the cost of health care and improve the access of health care and so on. But it does create economic chaos for us, the physicians in the hospitals. In addition to speaking, I do transactions. I represent doctors in transactions with hospitals, hospitals in transactions with physicians. By the way, it's the worst part of my day. But I do it because that's where healthcare happens, in the financial transactions between